Before you spend a single dollar on so-called male enhancers, I want to give you a calm, clear map of what really helps, what sometimes helps, what often disappoints, and what can quietly work against your vitality. I'm Susan Parker, your wellness guide. This is education for mature men who want reliable energy, steady confidence with their partner, and better intimate health without risky shortcuts or confusing jargon. No hype, no scare tactics, just the practical truth you can use today. For years, many men have heard the same myth, that vitality fades inevitably with age, and the only answer is a pill, a powder, or a secret plant from far away. The reality is kinder and more empowering. Your body holds a remarkable potential to restore circulation, rebuild strength, and recover confidence when you send it the right signals. Enhancers can play a small role for some men, but they are not the engine of lasting change. The engine is you, your daily choices, your blood flow, your sleep, your muscle, your breath, and your attention. My goal is simple. Before you choose any enhancer, you'll know exactly what it can and cannot do, how to protect yourself from common mistakes, and how to build a foundation that makes any safe tool work better. Let's start with the honest questions most men have, but rarely say out loud. Why do my afternoons feel heavy after meals? Why are my hands and feet cooler than before? Why do I feel fine one day and flat the next? Why has confidence become inconsistent when I want it most? None of this makes you weak. It makes you human in a body that adapts to your routine. Less movement after meals means slower glucose handling. Less muscle means less metabolic stability. Less sleep continuity means more stress chemistry. More sitting means fewer pulses of blood flow to the tissues that depend on it. Each of these shifts is small on its own. Together, they nudge your vitality downward. The good news is that small daily corrections stack up in the opposite direction just as quietly and often just as fast. Before we break down enhancers, I want you to know the single pathway that determines most of the feel of male vitality in the moment. Circulation. Blood flow brings oxygen and nutrients to every organ, including the pelvis. Blood flow depends on the health of the inner lining of your arteries, a living tissue called the endothelium. When that lining senses gentle, rhythmic movement, it releases a messenger called nitric oxide. Nitric oxide tells your blood vessels to relax and become more elastic. Elastic vessels deliver blood where you need it, when you need it. When you care for your endothelium, you support your intimate health, your stamina, your mood, and your day-to-day energy. When men say an enhancer worked, they're often feeling the downstream effect of better blood flow, better nervous system balance, or both. Now let's clarify the landscape. People use the phrase male enhancers to describe many different things. Some are prescription therapies your clinician might manage. Some are over-the-counter supplements like amino acids or plant extracts. Some are lifestyle tools disguised as products. Here is the truth you need in one sentence. If your foundation is weak, enhancers will give brief bumps and long frustrations. If your foundation is strong, you may not need an enhancer at all. And if you still choose to try one, you'll be safer, and you'll know how to judge real effects. Foundation first. This is not moral advice. It's physics and physiology. You need 3 daily pillars: movement that nudges nitric oxide, sleep that repairs hormones, and meals that don't overwhelm your circulation. Begin with a habit so simple it sounds trivial: a 10-minute walk within 20 minutes after your largest meal. Keep the pace comfortable enough to speak in short sentences. That's it. This single practice lowers post-meal heaviness, steadies energy, and sends the precise flow signal your arteries love. Men often notice warmer hands and a lighter head within the first week. Many also notice a calmer nervous system in the evening, which matters for connection with your partner and for sleep quality. Keep this short walk, and you already improved the return on investment of any enhancer by more than any label will admit. Next pillar, muscle. Muscle is not about size here. It's about function. 2 short strength sessions per week protect your circulation, your joints, your posture, and your confidence. Do simple movements you can maintain. Sit to stand from a chair, wall push-ups, a row with a resistance band, a hip hinge with a light backpack, and a gentle calf raise using a door frame for balance. Keep each movement slow and controlled for 8 to 12 repetitions. Rest. Repeat 1 to 3 rounds. When muscle wakes up, the body clears glucose better, the endothelium receives more flow pulses, and your whole system runs smoother. You feel it in your steps. You feel it in your mood. You feel it in your presence with your partner. Third pillar, sleep continuity. Many men accept fragmented sleep as normal. It is common, but it is not harmless. Sleep shifts your chemistry toward repair. When sleep is steady, daytime blood pressure behaves, appetite signals normalize, motivation returns, and intimate confidence is easier. Pick one anchor, a consistent wake-up time. Protect light exposure in the morning, dim screens at night, and keep the bedroom cool and quiet. If you enjoy a warm shower before bed, savor it. The cooling that follows helps the body drift into deeper rest. This is not luxury. It is maintenance for a mature nervous system. With this foundation, let's examine enhancers in plain language. The first group includes nutrients that support nitric oxide or circulation indirectly. Citrulline, found naturally in watermelon extract, is converted in the body to arginine, which supports nitric oxide production in the endothelium. Some men report a subtle improvement in exercise tolerance or a slightly warmer feel in the extremities when they use it consistently. The key word is consistently. It is not a switch. If you test it, measure your results with something real. Your morning energy, your perceived warmth in hands and feet, your ability to climb stairs without heavy breathing, or your confidence during a gentle walk with your partner in the evening. If there is no change after several weeks, accept that your body may respond better to movement and sleep than to that nutrient. That is not a failure. It is feedback. Another common route is dietary nitrate from whole foods like beets and leafy greens. Your body can turn these into nitric oxide, especially when your mouth's natural bacteria are healthy. Mouthwash used all day can reduce this pathway, so if you rely on strong mouthwash morning and night, try limiting it or spacing it away from nitrate-rich meals. With beets, moderation matters. A small portion in salads or a simple beet smoothie now and then can support circulation. More is not necessarily better, and whole foods carry fiber and minerals that help digestion and blood pressure. Adaptogens and hormone-adjacent herbs come next. Some men explore plants like ashwagandha or tonkat ali, seeking more drive or resilience. Here's the grounded view. These plants may help stress handling or energy in certain individuals, but effects vary widely. They take time, and they work best when sleep and strength are already in place. If you choose to test one, do not stack 5 at once. Test one change at a time for a defined trial, such as 4 to 8 weeks, and choose a clean product from a reputable brand that discloses testing for purity. Your measure of success is not a number you can't see. It is your lived day, steadier mood, easier wake-ups, calmer evenings, and a more reliable sense of readiness. Some enhancers are marketed as instant confidence. Be very careful with anything that promises sudden intensity without context. Many of those products lean on stimulants. Stimulants can raise heart rate and tighten blood vessels. That is the opposite of what you want for intimate health. The feeling of a jolt is not the same as healthy circulation. If a product lists a long blend of proprietary ingredients without clear amounts, respect your biology and walk away. Your cardiovascular system deserves transparency. There's also a group of substances that can interact with common medications. If you use therapies for heart conditions or blood pressure, or if you take nitrates prescribed by your clinician, you must treat any enhancer as a formal decision. Never combine something that alters circulation with a prescription that does the same, unless your healthcare professional has advised it. This is not fear. It is basic safety. The path to consistent intimacy is paved with confidence in your body, not with worry about odd heart sensations after a powder you found online. Let's talk about expectations. Many men want a guarantee. Biology doesn't sell guarantees. It responds to signals. When circulation is supported by movement, when sleep allows repair, when muscle is active, small tools can add a noticeable benefit. When those signals are missing, enhancers often do very little, and men blame themselves. You did not fail. The tool was misused. It's like asking a magnifying glass to light a room that has no lamp. The magnifying glass can only focus what already exists. Focus on creating the light first. What about timing? If you want to test a nutrient that supports nitric oxide, pair it with the habits that boost it naturally. Take it with a nitrate-friendly meal like a salad with leafy greens or a simple beet side, and then go for your 10-minute walk. Drink water through the day so your blood isn't sluggish. Keep caffeine earlier, not late, so your sleep remains strong. Do your short strength session twice a week. These layers cooperate. You are building a system, not chasing a spark. Alcohol deserves a clear note. Many men use it to relax or to feel social confidence. In small amounts for some people, it lowers guard. In the body, it often lowers circulation where you want it and disrupts sleep. If you notice inconsistent confidence on evenings with drinks, this is likely why. Try a 2-week experiment with no alcohol. See what happens to your energy, your sleep, and your intimate readiness. If you enjoy a ritual in your hand in the evening, swap to an herbal infusion or sparkling water with a slice of citrus. Keep the ritual. Change the content. Hydration seems too simple to mention, yet it changes how blood moves. Drink a glass of water upon waking. Add a glass after your largest meal. Keep a small bottle nearby during the day. Dehydration makes your heart work harder. Adequate hydration makes every enhancer more honest. You will feel the difference in your steps and in your focus. Weight is a sensitive topic. You do not need to chase a perfect scale number to regain vitality. You need to restore better signaling. When you walk after meals, clear glucose more smoothly, sleep more steadily, and lift your body weight twice a week, your waist often reduces a little. That small change makes a large difference in blood flow mechanics and in how your body handles stress chemistry. Confidence rises not because a product changed you overnight, but because your body recognizes itself again. Now let's address something that frustrates many couples: mismatched timing. One partner is ready and calm, the other is tense and distracted. No enhancer fixes misaligned nervous systems. The fastest bridge is shared rituals that settle both bodies. A 10-minute evening walk together, at a gentle pace and without screens, does more for harmony than any capsule I could name. Walking side by side lowers the sense of confrontation. Conversation flows. Smiles return. Shoulders drop. This comfort sets a tone that carries into the rest of the evening. Intimate health loves safety and warmth. Your walk creates both. Pelvic floor awareness is another quiet lever. Many men carry tension in the pelvis without noticing it, especially men who sit long hours. Tension can restrict circulation and create a background sense of pressure that feels discouraging. Simple awareness helps. A few times a day, breathe in gently and imagine your lower belly widening. On the exhale, soften your jaw and let the pelvic floor relax rather than clench. Do not force anything. Think release, not effort. This small habit reduces unnecessary tightness and allows blood to move. Let's circle back to supplements men ask me about most. Citrulline can be reasonable in a simple daily dose for a trial. Beetroot powder can be reasonable if you tolerate it and prefer food-based support. Magnesium glycinate in the evening can help many men unwind and sleep more steadily, which indirectly supports intimate health. Zinc should not be megadosed. A normal intake from food plus a modest supplement, if your diet lacks it, is enough. Ashwagandha may help perceive stress and sleep quality for some. Tonkat Ali is often marketed heavily. Some men report improved drive. but others feel nothing or feel wired. The safe approach is always the same. One change at a time, clean sourcing, several weeks of observation, and a willingness to stop if your body says no. If a product claims to do everything, it usually does nothing well. I also want you to understand the difference between sensation and function. Stimulant-heavy blends create sensation, a flush, a buzz, a sense of urgency. Function is the ability to relax, receive blood, and maintain steady confidence. Sensation without function is a tease that fades quickly. Function without sensation is quiet and dependable. Build function. Choose tools that respect it. If an enhancer makes you feel rushed or restless, it is likely working against the goal. Let's talk red flags. If a product hides behind a proprietary blend without disclosing amounts, that is a red flag. If a label promises immediate, extreme effects for every man, that is a red flag. If a seller discourages you from maintaining movement, sleep, and simple nutrition because their formula handles it, that is a red flag. If a brand insults you as a strategy to make you buy more, that is not wellness. That is manipulation. You deserve respect and clarity. What about labs and numbers? Some men benefit from checking basic markers with their clinician: blood pressure, fasting glucose, A1C, a lipid panel, and if indicated, hormone levels interpreted in context. Numbers give you a map. You don't need perfect numbers to feel better, but you do need to know if there is a clear barrier, like unchecked blood pressure or unrecognized sleep apnea. If sleep is loud with snoring and daytime sleepiness, address that first. It changes everything downstream. Now let's build you a simple 30-day plan that requires no special equipment and creates the best stage for any safe enhancer you might test later. Days 1 through 7. Choose your largest meal of the day and walk for 10 minutes within 20 minutes of finishing it. Keep the pace comfortable. Drink a glass of water after the walk. Go to bed at a consistent time and wake at a consistent time. Reduce screens 1 hour before bed. Do one strength session with chair sit-to-stands, wall push-ups, band rows, and calf raises. Make it short and honest. Days 8 through 14. Keep the first walk and add a second 10-minute walk after another meal, ideally dinner. Add your second strength session this week. Keep your wake time steady. If you drink alcohol, pause it for this week and notice your sleep. Days 15 through 21. If you want to test a simple enhancer like citrulline or a small beet component, start now and change nothing else. Do not add 3 things at once. Observe your mornings, your warmth, your calm. Days 22 through 30. Continue. Decide with your own data whether the enhancer added value. If it did not, drop it with zero guilt. Your foundation is already doing the heavy lifting. What changes should you look for that actually matter? Warmth in hands and feet during the day. A lighter feel after meals. Easier stairs. A more even mood in the afternoon. Less nighttime restlessness. A soft return of playful confidence with your partner, not forced, just available. These markers reflect real improvements in circulation, nervous system balance, and energy handling. They are better than any claim on a bottle. Some men ask about urgency. I have an important evening. I need something now. The most reliable same-day tools are not products, they are behaviors. Keep your day's meals modest in portion, avoid heavy sauces, drink water, take your walks, protect your short strength routine earlier in the day, and keep screens gentle in the evening. These steps lower your stress chemistry and open your vessels without surprises. If you also use a familiar, well-tolerated nutrient that supports circulation, do so within your safe routine. Never add a new stimulant before an important moment. New stimulants and important evenings do not mix. A note on confidence. Many men think confidence arrives after their body changes. Often the opposite is true. Confidence returns the moment you act in a way that aligns with care. You walk after your meal. You lift your body weight with respect. You drink water and go to bed on time. These small decisions tell your nervous system a new story. I can trust myself. Your partner senses it without a word. The body follows the story you repeat. Let's include a few brief, inspiring stories that mirror what many men experience. A 64-year-old professional who sat most days added a 10-minute lunch walk. He noticed lighter afternoons in 1 week. In week 2, he added evening walks with his partner. They talked more. Tension at home dropped. He later tried a small beet smoothie twice a week and felt a pleasant warmth during evening strolls. He never bought a flashy enhancer. He restored function, and the sensation came from his own biology. A 57-year-old teacher returned to short strength sessions twice a week and guarded his sleep. After a month, he tested a simple magnesium glycinate at night. His sleep deepened, headaches faded, and mornings felt calm. He described his intimate confidence as quiet and dependable for the first time in years. A 60-year-old engineer had relied on strong mouthwash morning and night. He switched to a gentler approach and spaced it further from meals while adding leafy greens to lunch. Evening walks followed. He reported a subtle but steady improvement in warmth and mood. None of these men chased extremes. They built a base and let their body help them. Sometimes men worry about enthusiasm fading. Expect a dip around week 3. It happens in every change. The novelty is gone. Results feel normal. This is not failure. It is the moment where consistency forges identity. Use a simple calendar and mark your walks and strength days with a check. Aim for progress, not perfection. If you miss a day, you do not start over. You continue. The body remembers patterns, not single events. Supplements often include claims about hormones. Be skeptical of lofty promises. Male vitality is not a single number. It is a network. Circulation, muscle activity, sleep rhythm, stress handling, nutrition, and connection. You can feel better before any lab moves, and sometimes without it moving at all, because function is more than a lab snapshot. If you do track labs, look for trends over months, not a miracle in days. Trends reflect habits. Habits change your life. I also want to touch on prostate comfort because many men in midlife worry about it quietly. Movement helps. Hydration helps. Not pushing the bladder too long helps. Caffeine late in the day can nudge nighttime bathroom trips. Alcohol can do the same. A calmer evening routine with a short walk, lighter dinner, and an earlier cutoff for fluids can reduce nighttime disruptions. Better sleep means better evening confidence and better daytime energy. This circle of care feeds itself. When should you absolutely slow down and speak with a professional before trying any enhancer? If you have chest discomfort, significant shortness of breath with little effort, new leg swelling, sudden dizziness, or severe headaches. If you have a history of heart conditions and take medications that affect circulation. If you were advised to avoid certain nutrients due to medical conditions. The smart move is not to be brave alone. The smart move is to be guided and then thrive. Let's end with a quick checklist you can keep in your mind. Walk 10 minutes after your biggest meal. Twice a week, do short strength sessions that respect your joints. Hydrate through the day. Keep your wake time steady and dim screens at night. If you experiment with a simple enhancer, do it one at a time. Choose clean products and give it several weeks while tracking real-life markers. Avoid stimulant blends and secret formulas. Protect your nervous system. Nourish your endothelium. Talk with your partner during shared walks and let warmth return from the inside out. If you came here looking for the one product that fixes everything, I hope you leave with something better. A plan that returns your energy, your steadiness, and your confidence without gambling on your health. Enhancers can be minor allies when you already lead. You are the major force, your steps after dinner, your gentle strength sessions, your sleep, your water, your breath. These are not glamorous. They are effective. They restore the very function that expensive labels try to imitate. Before you take any male enhancer, look at the foundation. Support circulation with simple movement. Train just enough muscle to remind your body what it is for. Sleep like it matters, because it does. Eat in ways that help your vessels, not fight them. Then, if you still want to test a nutrient, do it with respect for your biology and patience for your timeline. Real effects are steady, warm, and reliable. They feel like you at your best, present, calm, and ready, without drama. If this message resonates, apply one change today. Take your 10-minute walk after your next meal. Feel the difference in your head and your hands. Notice how the evening softens. If you want to share this plan with someone who matters to you, invite them to join you on that walk. Vitality in the mature years is not a myth. It is a daily practice, and you are absolutely capable of it.